So now I turn over the floor to Dr. Lee to talk on from minimally invasive surgery to non-invasive surgery. HIFU is revolutionary and disruptive. Dr. Lee?
Can you all see me? Can you see my slides?
Yes, doc, you can see it.
You can see my slides?
Yes, Dr. Lee.
Okay, thank you, Dr. Soraya. That was a wonderful lecture. I think your residents will appreciate very much. And I didn't know that residents that is joining this seminar, but then can I just have a word to all the residents? Whatever you do, residents, please follow the instructions and the teachings of your supervisors or teachers. Because whatever I'm going to say is a very personal view, which I always joke, parental guidance needed, or in this case, supervisor's guidance needed, because it's really my personal view, and I wish all of you will pass your exams. Thank you once again, PSGE, for inviting me. Thank you to the president of the society, Dr. Prudence, and the vice president of the society, Dr. Maria Habana, and the chairpersons and co-chairpersons. My talk today, oops, how do I switch my slide? Okay, is from minimally invasive surgery and non-invasive surgery. And I think HIFU is revolutionary and disruptive. Before I start the lecture proper, let's take a walk down memory lane that gives me a chance to say hello to all my friends in Philippines. I met all of you again in July 2019 in Chongqing. I hope I get the names correct. Doctors Angelito, Dr. Avril, Dr. Becky, Eileen Manalo, San Juan, and Karin, hello. And in front is Professor Felix, and this is Professor Hugo. And I'm really, really impressed when I was invited last year in Manila to your PSGE convention. You call it the East Meets the West. And here are some pictures which I kept for remembrance. This is a wonderful meeting whereby, as you note, there are people singing away, dancing away, and look at this corner. In one corner, you see some of the Asian doctors are only interested in taking pictures and doesn't know how to enjoy. And it's because of these pictures, it sets the mood of my talk. Oh, another one which I would like to say hello to those who follow me on the Three Gorges Forum. This is a really intensive forum. We were held up for 3 days, doing nothing but talking about surgery and gynecology, and only when the sheep, dogs, then we are allowed to run out like wild animals. Okay, I'm close to this society called APAGE, Asia Pacific Association of Minimally Invasive Endoscopy, founded in 2003. Just to show you some of the board members, the most famous, I believe, is Dr. Professor Li Qilong from Changkeng University. And this is the president-elect of APAGE, Professor Prashant, and of course, this is Harry Rich. Okay, my talk is centered around HIFU, which stands for High Intensity Focused Ultrasound, which I believe will be a procedure that will change the practice of gynecology and will add a new dimension to the treatment of uterine fibroids and adenomyosis, and little changes probably in your standard textbooks. I hope to cover this. What is HIFU? Why the evolution, a personal evolution, and what is the effect to gynecology? And I call it the revolution, the change, and the disruption. In modern meaning, disruption means improvement, a positive improvement. In my days when I was a student, disruption is actually a bad word, means you interrupt something good. Also, will HIFU answer the main roles of myomectomy, which Dr. Soraya has covered in her lecture, and which I think most of us will acknowledge the main problems with myomectomy will be hemorrhage, and sometimes you got to convert to a hysterectomy, and post-op adhesions, which may affect fertility, uterine rupture during pregnancy, and the last one I put, morcellation risk. To me, it's a dilemma probably created by us doctors. And last, what's our aim as a doctor? Our aim mainly is to have no pain with the use of small scars or no scar, a speedy recovery for our patients, and minimal complications. To deal with the last point is the easiest, because all of us doctors are learning to be good doctors and surgeons. We believe what Sir William Osler said, diseases that harm require therapies that harm less. Remember, it's harmless and not harmless. All therapies have some form of side effect. And why do we learn to operate in a very constrained manner, like, back-breaking laparoscopies to achieve smaller scars? Is to provide less pain. And with that, hopefully the patient can recover and eat sooner and to return to normal activities faster. And we do hope with less complication compared to conventional surgery, it is better for our patient. So this sort of calling should be second nature to us. Today I'm talking about a knife, which is called a virtual knife or an invisible knife. This is not an MRI machine, and the knife is actually here, from here, this way. It is an ultrasound knife, which has the depth of about 12 centimeters coming out from here. Now, I have a recording of this video, which I've taken personally, to show you that from the ultrasound and to here is about 12 centimeters. And this is a treatment bowl or the active element of the HIFU machine. If you put the hand across, you don't feel the heat. But if you put it at 12 centimeters or 13 centimeters, that's where the focus of the heat or the ultrasound will be. Let's watch this clip. You see, I have a friend to put a hand across. No burns. No burns. And another friend to put it across, again, no burns. So it is very safe unless you put it at the 12 centimeter point. Okay, sorry. Okay. This is the animation or program. You see that this is the treatment head, which actually ablates millimeter by millimeter. Every little burn or treated area is about 1 millimeter by a length of about 3 millimeter. It goes this way in slices. Or to put it another way, if I move this treatment head to the tissue, and when I press the button to treat or to fire, the ablated area turns white, or we call this a gray scale change, like so. So I will move, once I see a change, I'll move to another location to ablate the tissue. Now, what is therapeutic HIFU used for in present day? It is used for the uterus, breast, liver, in especially palliative treatment of cancer of the liver, palliative treatment for cancer of the pancreas, kidney, bones, bone cancers, soft tissue like the thyroid, and a lot more. And in gynecology, the main use for uterine fibroids and adenomyosis, placenta accreta, cesarean sections, cesarean pregnancy scars, and abdominal wall endometriosis. I have evolved from open surgery to keyhole to what's next? Is it a single puncture, which still has a scar, or to nodes, natural orifice trans-endoscopic surgery, which still has a scar? I believe HIFU is really truly scarless. Now I'm going to show you a video. After watching this short clip, which I believe a picture is worth 1,000 words, you understand what I mean. Patient walks in, and lies down, prone position. Remember, it's prone position. And the doctor converses with the patient to ask her, is it okay? Do you feel any discomfort? Do you feel any pain? And this is an MRI image which he used to check. During the treatment, he's always talking to the patient, how are you feeling? Is there any pain? And this is monitored by a real-time ultrasound. The treatment in a simple fibroid of 5 centimeters takes only 1 to 2 hours, and the patient goes back to the wards. Oops, need to change this? No. Okay. And I want to explain to you, there are 2 types of delivery of HIFU. One is by MRI, which is usually done in the radiology department. And the other one, which I'm talking about, is ultrasound guided, which has more ablative capacity compared to MRI guided, which is just mainly heat. The difference, if you notice, MRI, of course, the image is much better than ultrasound. They have a temperature monitoring, which is real time, but not an image monitoring, and which is not real time. The transducer movement, because it's housed, you have to house the patient in the MRI machine, is limited. Whereas in the ultrasound guided HIFU, the patient is not housed in a machine. So the position of the patient can vary, can be adjusted in an ultrasound guided HIFU. Not so in an MRI guided HIFU, because you are in a chamber and you're not supposed to move. The treatment time in an MRI guided HIFU is much longer than an ultrasound guided HIFU. And basically, you're using 2 devices. One is the MRI and one is the HIFU machine. So the treatment cost is definitely more. The efficiency or the treatment efficiency is much lower in the MRI guided HIFU, but in the ultrasound guided HIFU, it's more efficient. You achieve a treatment efficiency of 80 to 90%. You need the NPV, a non-perfused volume, of more than 70% to have satisfactory results. I've said before, treatment costs, because you're occupying the X-ray machine and your fellow radiologist, is going to be more. What's interesting to me is the operator. In an ultrasound guided HIFU, any of the gynecologists or a trained doctor can operate it. But in an MRI guided HIFU, you really need to trouble your radiologist colleagues who sit next to you, and you're out of the chamber. You are in a separate room when you're doing MRI guided HIFU. So there's no way you can talk to your patient. So in summary, ultrasound guided HIFU can be done by a gynecologist or any trained doctor. The duration of ultrasound guided HIFU procedure is independent of where you put your MRI machine, and your MRI facility can be put to better use. So it can be, ultrasound guided HIFU can be located away from the X-ray department. In fact, it can be housed in any day surgery center, outpatient department, or even in Korea. I've seen my colleagues having their treatment in a shopping center. Now, not known to many of us, ultrasound guided HIFU has been used in 26 countries or regions. And to date, this is the old figure, already 160,000 cases has been done compared to just 4,000 cases of combined MRI guided HIFU, which is from 2 companies, Insightec and or Philips. Are there research and scientific papers on HIFU technology and medicine? Plenty, a lot. But because we are most of the time aligned to medical institutions written in English, like the Lancet, New England Journal, we normally overlook what is written by Asians. So I'll quote one of the simplest papers. This came out of Chongqing University. It's about 757 patients with 1,000 over fibroids. This is from the Chongqing Medical University. And I use this because it's easy to quote and simple to explain to my patients. Altogether, 757 patients. The number of fibroids are written here. The volume of fibroids is here. And the non-NPV, that means the efficiency of treatment they managed to achieve is more than 70%. This is a simple graph to show my patients after HIFU, how long will the symptoms like menorrhagia or pain disappear? It disappears about 3 to 6 months, and it continues disappearing. What about fibroid shrinkage? Well, fibroid shrinkage, after, again, very easy to remember. After 3 months, it's about 30%. After 6 months, it's about 50%, and so on and so forth. I just give you a sample of all the articles which you can find, but I would like to highlight to you, if there's one article you want to read, is this one from National Institute of Health and Care Excellence, dated 24th July 2019, NICE guideline. And in it, it has a summary of the 5 or 6 articles which are used to base their judgment on, so that they approve now ultrasound-guided HIFU for symptomatic uterine fibroids. And I would like to highlight that Professor David Cranston, the president of research on HIFU, he has in his team in Oxford, in conjunction with Chongqing University, a department of gynae HIFU, renal HIFU, neurosurgical HIFU, breast, pancreas, sarcoma, prostate, and drug delivery. And I know places like in even Myanmar and even Singapore, we use it for palliative treatment of liver and pancreatic cancer. And I'm aware that I met a young man from France. He's using HIFU for deep infiltrating endometriosis. So for those of you who are learning or contemplating to do laparoscopic surgery on DIE, this may be something for you to take note of. Very important, this is Professor David Cranston, this is Professor Li Qilong. So the two societies met last year in Chongqing, and they signed a memorandum of understanding to cover training, education, research, and very important, certification. Now, complication rates and side effects in HIFU is very low compared to conventional surgeries. If there's a paper you want to remember, it's this paper, Adverse Effect Analysis of HIFU in the Treatment of Benign Uterine Diseases. And you will note, this paper has 27,000 patients, not 27 patients or 22,700, but 27,000 patients. And I will highlight to you, they class the side effects or complications into A, B, C, and D. D is probably the most major. And if you look under D, you don't find vessel, arterial, or venous injuries, but you do find bowel injuries. And how many bowel injury? 4 out of 27,000. That gives you a percentage of 0.0148%. Now, if you match this to a table which I've been using for the past 25 years when I explain to patients about the complications of laparoscopy, laparotomy, you find that bowel injury, the incidence is 0.04 to 0.3. And if you compare this to 0.01, this is like 4 times more or 4 times less in HIFU, and this is about 30 times less if you do HIFU. Just 2 more papers. You may be of interest if you want to know what is the result of HIFU on fertility. 79 patients in a paper written by our Korean colleagues and published in British Journal of ONG. HIFU treatment does not affect ovarian reserve. It states AMH levels before and 6 months after HIFU, no significant difference. Another paper on HIFU, 70 patients conceived after HIFU treatment, and the conclusion is it could significantly reduce the preparation period for pregnancy after HIFU. It can also improve fertility of patients with a history of infertility, abnormal pregnancy, and childbearing with no additional obstetric risk. I like this sort of conclusions because it's simple. Everybody gets a message instead of some generic conclusions like more studies are needed. And there's a collection which I got this from Chongqing, China. They have collected about more than 1,500 pregnancies. And you know, in China, just before 2 years ago, you are not supposed to encourage pregnancy. So there may be more pregnancies than this, which is hidden under the carpet or swept under the carpet. This is my colleague, Dr. Hong Si-Chin, and she was with me. 2018, we visited Chongqing HIFU Hospital, and this is her first successful pregnancy after treating somebody with multiple fibroids. And right now, another colleague has a successful pregnancy in the 2nd trimester, again after treatment of HIFU for fibroids. This is a reminder for me that I'm halfway through and I have to go a little faster. Oh, finally, the sound of HIFU or the sound of music reaches Singapore in July 2018. So we are still very new in this management. Happy to show you that on the 16th of July 2018, our first case treated by a team in Singapore. And bear with me, a short video and full of excitement. This is live, real time, and before we shoot, we have to make sure the bowel, which is, you can see the bowel here, which is moving, is away from the line of fire. Okay, and every time we fire, it changes gray or white. And you can hear the excitement when something white appears. It's like snowing, you know, in this area. And I can tell you the excitement is fantastic. And I always say this without shame, that it's like holding your girlfriend's hand for the first time. It's really exciting. Okay, I stop here. Oops. So the same patient, I did her on a Monday. And I gave her 1 week of medical leave, but on Wednesday, she posted this picture of her doing her climbing, returning to her usual activity. But I did warn her, please be careful, because it's still a form of surgery, although you don't feel the scar and don't feel the pain. 5 months later, she went snowboarding, and she posted this picture and sent it back to me. And this is with her permission, which I'm showing you. And this is her MRI. Her fibroid was 48 by 37.9 mm. After treatment, actually before a year later, a few months later, it shows it is 38.5 by 38 mm. What's important is her hemoglobin improved and her periods are no longer heavy. I show another MRI of a patient, 54 years old, heavy period and in pain. You may comment that anybody 54 years old should be going menopause and there's no treatment needed. However, let me remind you, a 54-year-old in today's day and age dresses and behaves like a 34-year-old. And if you say, oh, maybe take off your uterus, I tell you, if she has a gun, she will fire it at your face. 9 months later, after HIFU, the fibroid shrinks. And just to prove to myself and my critics, I actually did a hormonal profile, and it is as young as a 40 years old. So don't write off anybody who is 54 years old. I call this technique revolutionary and disruptive. The reason being, just like all of us who started off with MIS or keyhole surgery, and this is done in preference to open surgeries nowadays, we have our criticism from a lot of colleagues who doesn't do keyhole surgeries, and we were the brunt of a lot of jokes. But if you ask women now, more women will choose non-invasive. In other words, no scars over a surgery with a scar. This is no-brainer. Furthermore, there will be less debate over whether you want to morcellate your fibroid in a bag and then stitch with barbed wires. You have less of all these headaches. And what is more interesting to me, especially for those of you who have loads of patients for IVF with adenomyosis, I think there's hope for them without surgery. And in fact, now, a lot of IVF colleagues refer the patients to me. I don't do IVF, but you know, they also do not like to face patients with adenomyosis. So the use of operation rooms will be less. There will be less use of endovision camera system, OT equipments, but very important, less blood transfusion, especially now with COVID in the world. We have less people coming forward for blood donation, and the hospitals are limiting operations that will need blood transfusion. So it's a good thing to have now. There's better deployment of your operation room facilities like nurses, doctors, and technicians. And to the hospital is definitely a positive saving. You won't need all this if you do HIFU. And I show this picture again. Remember, I call this a dilemma. It's really a dilemma started by us doctors. And we somehow, in this case, whereby unfortunately a colleague suffered from a hidden or undiagnosed leiomyosarcoma, and the good doctor actually meant well, used a morcellator to remove the fibroids, and this poor morcellator gets blamed for upstaging the cancer. But we all know that when we do myomectomy, whether it's open or minimally invasive or robotic, the first cut on an unsuspecting leiomyosarcoma, and then you tuck on it to encapsulate it, and then you put it somewhere waiting for the morcellate to come in. The very moment you cut into the uterus, you have already upstaged the leiomyosarcoma. So I don't think we should blame the morcellator. A very good description by the president-elect of APAGE regarding the use of morcellation bags is food for thought. It's like after sex, then you use a condom. It's food for thought. But for residents, please follow what your teachers say. Okay, surgeries for fibroids and adenomyosis and hysterectomies will definitely drop. This is actually to the betterment of our female patients. There will be a reduction in the use of medication like ulipristal acetate, or we call it Asmir in Singapore. This has, I just put it up for information. This is already banned in Singapore and a lot of other countries. There will be less use of anti-adhesion products. There will be maybe more use of GnRH agonists to reduce the size of the fibroid or adenomyosis before HIFU treatment. At the same time, it helps to bring up the hemoglobin level while waiting for the GnRH agonist to act. And there will be a more use of your MRI machines if you have one in the hospital, and there will be more use of the contrast media. Now, competition-wise, for those of you who use radio frequency to treat fibroids, I'm afraid this will be less popular. And for those who use uterine artery embolization, which actually embolizes the whole uterus and may even stuff the affect the blood supply to the ovary, this may not be preferred by patients. All this technology, TrueClear, Bicati, MyoSure, and all these endometrial ablation modalities will probably drop in demand because, let me show you, this is a 4 cm submucous fibroid. After treatment with HIFU, was just passed out. 4 centimeters. This picture comes from my colleague, Dr. Tan, who uses the HIFU to treat the fibroid. This is my patient, a nurse, after treatment of fibroid. Some of these fibroids, which could be intramural, but quite near to endometrium, get passed out. Always remember, the uterus decides what to do with the treated fibroid. And this is a very nice case of mine. Last year in July, I treated her with HIFU for intramural fibroids, actually more than one fibroid. And the biggest one, you can see it as an indentation in this hysteroscopic picture, just an indentation on the roof. When I reduce the pressure, it does come down, but it doesn't come down like a submucous type 1, type 2, or type 0. This is what I see. But lo and behold, this intramural fibroid, which is about 6 centimeters, came down after 9 months post-HIFU, and can you see it appearing? Like the moon is appearing. And it has become from intramural to become submucous. So I'm waiting for it to reduce to about 3 centimeters, and I'll remove it hysteroscopically with a resectoscope. What about our maternal fetal medicine ultrasound subspecialists? You know, we have a group of colleagues who are not in favor of going to scrub to in major theater. They prefer to do ultrasounds, and for antenatal cases and for deliveries, maybe it's time for those who do not like to scrub up to jump into the bandwagon and to be a surgeon again, because in HIFU, you do not need to scrub up like in major surgery. Very interesting, because they are very used to looking at ultrasounds. But of course, this most of the colleagues who are in the ultrasound room and in maternal fetal do not attend lectures on laparoscopy and gynecology. Now, who is good to adopt, to accept, or to pick up HIFU? I think if you have spatial orientation, it's good when you do ultrasound, or you can drive around without a GPS, that would be good. People with pelvic ultrasound experience, I think all of you have pelvic ultrasound experience, would be good. You have to learn how to interpret MRI. I, for one, have not learned MRI when I passed out from school. Now I pick up the MRI from my colleagues. Very important. And I think all of you will have patients, which is inborn. Otherwise, you won't be waiting for your delivery of babies. And very important, like all good doctors, abide by safety guidelines and discipline, discipline, and discipline. Now, will HIFU replace open and minimally invasive surgery? The answer is no, for very good reasons. For example, not everybody is treated by HIFU, and I'm satisfied with. This is a 40-year-old with diffuse adenomyosis. And after 6 months, I find that the size of the uterus is still there, although the symptoms has very much improved. So it's a personal judgment where I'm concerned. This is a patient, 48 years old, complained of swollen legs while walking and standing. She has seen a lot of physicians, and they told her there's nothing wrong with the kidney, liver, or the heart. But on MRI, you see this mass here. This mass here, same. This mass here is actually a fibroid coming out from, this is the cervix. This is the cervix. This is the upper part of the vagina, coming out from the back of the uterus, from the internal os of the cervix, or the uterine cervical junction, and protruding backwards into the sacrum, very close to the sacrum, and this is the colon and the rectum. So in this case, because of the size, and because if I fire this way, I may allow the energy to pass through the fibroid and hit the rectum or the sacrum. I declined HIFU for her, and I offer laparoscopy. This is the MRI picture. You can see the whole mass stretches from the right to the left, the whole pelvis. And because of that, it actually obstructs the blood flow, and that's where her leg swellings came from. So this is a fibroid deep in the pouch of Douglas. This is a fibroid from left to right. And after myomectomy, after stitching, this was where the fibroid was occupying, pressing on the nerves and the blood vessels. So after that, she doesn't have edema of the legs anymore. So to all of you, it is good to learn a new procedure as another alternative to offer to patients, or just to inform the patient there's another technology alternative, or refer to appropriate HIFU department. This, I think, is the essence of good doctoring, or the spirit of doctors. I want you to remember, this invention is from Professor Wang Jibiao. He actually turned a knife in nature to something I call the invisible or the virtual knife. So please remember, we always remember the names like Harry Rich, and who is the person who invented antenatal ultrasound, but please do remember some things are coming out from Asia. And the preservation of femininity and fertility, in my opinion, HIFU is an excellent alternative treatment for fibroids and adenomyosis. Now, my last slide before I sign off is HIFU is not arcade games, although you're pressing on buttons. Neither is it a bowl of water with ultrasound. The whole thing, the whole treatment process, is actually acquiring a virtual therapeutic system that comes with research, teaching, learning, and management. It is a whole new world of surgery that demands undivided attention. That is your focus, or the team's focus, your judgment and skill.